Hi, this is Dr. Behnam. I'm a board-certified dermatologist, laser and skin cancer specialist, practicing Santa Monica, California. Today we have one of our lovely patients with us today, and we are going to have a frank interview about basically what has been going on. This is an educational piece, basically to educate our patients out there regarding the risk of melanoma. So we had our patient that came in, so tell us exactly what happened, what the story was, how the story went.
Well, okay, I wasn't prepared for this, but this is basically what happened, and it could happen to anyone out there. I was fine, I was healthy. All my doctors told me I looked 15 years younger than my actual age. Played a lot of tennis, very sports-minded. Went to the gym every day, and I was in perfect condition and health, I thought. And one day, when I was here at I went for some hair transplant, they noticed in particular mole on my leg. Fortunately, I was wearing shorts, and the good doctor happened to have taken a look at it, gave me a complete body check over, and thought that we may have a problem. They took a biopsy of several areas that looked suspicious, and when they came back from the lab, they gave me a call. I was completely shocked. It was the last thing I ever expected. And I have a history of loving to lie on the beach from when I was a teenager. I was on the beach 6 hours a day maybe. All I did was lie there, listen to the radio. Back then they had radios. And swimming, I was always outside. I love the sun. I moved to California because of the sun. And I kept doing the same thing, lying out whenever I can without any kind of protection. No hat, no glasses, no sunscreens. And I never felt sick a day in my life. Anyway, the biopsy came back positive, and fortunately, and thank you to the doctors, they found it in time. I went through sort of minor surgery, and thank God everything came out. Now I'm on a watch program every 3 months, probably maybe for the rest of my life. They'll be checking me out. But if it wasn't for them, and I was told back many years ago to protect yourself in the sun, and I thought nothing of it. I'm strong, I'm healthy, there was no cancer in my family, that I should watch out. But eventually, if you do abuse the sun, will get you before you get to the sun. So take it from me, sincerely, I'm not doing this for any money, I'm just trying to help you and the whole cancer scene to please, if you want to be in the sun, protect yourself, and hopefully you won't go through the minor stuff that I went through. It could be worse, but like I said, I was one of the lucky ones.
Yes, thank you so much. So I have a question for you. So basically it ended up that we had noticed a lesion on the leg, and actually the one on the leg wasn't really that bad. When we did a full skin exam, it was a lesion on the back.
Correct.
That turned out to be a melanoma. When you were younger, did you have a lot of sunburns on your back?
No. Most of it, when I was on the beach, I always lied with my face facing the sun. And very rarely did I do my back, because people don't see your back, they see your front, and that was what I wanted to expose myself to. And I thought that was weird, that the cancer would show up on my back, which actually had the least amount of sun open to it.
So unfortunately melanoma is also both genetics and the sun, so the combination of the two. So, I'm glad that we're able to catch in the time with the surgery. And thank God now, we're just basically, the goal is to monitor to make sure we don't have anything else come up. Again, the key is to really stay away from the sun. Unfortunately, the UV rays are very harmful to the skin, and it really bothers me when I see these young kids, even these days, they're out in the sun and tanning. You know, we just had the law passed in California that minors cannot tan anymore. I think that's definitely a good thing going forward. But I really greatly appreciate you trying to educate the public about just the dangers of melanomas and skin cancer. And the good thing is, if caught in time, and this will always say, if you catch it early, it is curative. It's just when you don't catch it in time, that's when you run into bad problems.
And the thing about catching it is that, in my case, I would have never in a million years thought I had cancer because I wasn't losing any weight. I didn't have any of the symptoms of possible cancer. So you just never know. And trust me when I tell you, don't think it won't happen to you, because the sun doesn't pick tall, dark, handsome, fat, skinny people. You're going to end up with it. It's just a matter of time if you don't take the proper precautions. It will happen to you.
Michael, thank you so much. I'm so happy we're able to caught it. You're welcome.
Thank you. When I tell you, don't think it won't happen to you, because the sun doesn't pick tall, dark, handsome, fat, skinny people. You're going to end up with it. It's just a matter of time if you don't take the proper precautions. It will happen to you.
Michael, thank you so much. I'm so happy we're able to caught it. You're welcome.
Thank you.
Do you just want to talk about the importance of cancer screening? You know?
Oh, okay.
So you could just continue.
Yeah.
Just continue.
So the importance of cancer screening is, so when was the last time you had your full skin exam checked?
I go for physicals once a year, and my regular general GP, he looked, but he didn't look. He's looking for other things.
Right, right.
He's not a specialist in skincare, and I would have never gone to a specialist. My GP said, I'm in great shape, keep it up, and I did. I didn't change, and like I said, it was a freak find. I would have never realized it, and by the time I would have realized it, I think it would have been too late.
Yeah, so this is the importance, you know, unfortunately in the US, you know, all the everything has become so specialized, so one field doesn't know about what the other field is doing. It's very important to get your skin checked once or twice a year, especially with just a history of tanning out in the sun. And when we do a skin check, we literally check from head to toe, the toe webs, the toenails, the skin underneath the toenails, you know, the groin area, the armpits, and the entire scalp between the hairs, you know, and also into the mouth. You know, these are the areas that unfortunately sometimes they might never even see the sun, but you could have a skin cancer there. So it's very important just to be checked once or twice a year. It's a 15-minute checkup, but it could really save your life if you let a melanoma go undetected. If it spreads even a little bit, unfortunately, it could be way too late.
I absolutely agree with you. And if you're thinking, I know times are tough today, about the financial, there are clinics, there are places to go if you can't afford to go to a dermatologist of your choice, but don't make that an excuse, because it's going to end up costing you your life if you can't come up with the funds needed to do that checkup. And make sure you go to a dermatologist. They're specialists. They know what to look for. Unfortunately, the GPs or your general doctor, health doctor, didn't have the years of education that goes along with it. So if you need an oil change, you go to a mechanic. Don't do these things yourself. Go to the specialist.